Terrel Bernard of the Buffalo Bills suffered a leg injury tonight against the Pittsburgh Steelers, where he actually needed to be in an air cast and to be carted off of the field. Initial speculation was that he was dealing with some sort of a fracture. However, it looks like sources currently are saying that the x-rays for his leg have been negative, and he's due to have an MRI tomorrow to confirm an ankle sprain. The position that Bernard's foot went into is a position known as inversion, and with today's video, I want to focus on why this is a risky position for the foot and ankle. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy, and with my channel, I take a look at sports injuries, and I explain them so that they're a little bit easier to understand. I also go over the relevant anatomy of that injury and talk about what that person should expect when they come to rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel, because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. We can see here on the injury video that as Bernard is going to make the tackle, his right foot is going to come around and that foot is just going to plant very awkwardly. Here I have a model of the foot and ankle, and so it's important to know that the ankle joint is formed by this tibia bone, also known as the shin bone, that's going to come down and form the inside piece, also known as the medial malleolus. Then as we flip this model towards the outside or lateral part here, we have the fibula bone that's going to come down and form the outside, also known as the lateral malleolus. Then as we look deeper into the model here, we have a bone known as the talus bone, and these bones together make up what we know as being the ankle joint. There are four major motions at the foot and ankle. The first one is known as dorsiflexion, where the foot and the toes are going to come up like this. The opposite of that is known as plantar flexion, where the foot and toes are going to be going downward like this. Then as we flip the model over right in through here, we see this motion right here. This is known as inversion, and this is very applicable for this video. And the opposite of that is known as eversion. Now let's talk about why inversion is a very risky position for the ankle joint. Anytime a person is going to go beyond their normal value, especially when it's forced in an accident such as a sporting event, that is going to stress all of those structures that are located laterally or on the outside portion of the ankle. And there are three ligaments that contribute to overall ankle stability. The first one is known as the ATFL, which stands for the anterior talofibular ligament. So anterior means that it's towards the front, talofibular meaning that it's attaching the talus and the fibula together. Then, as we move slightly back on the model here, we have the calcaneofibular ligament, meaning that it's going to attach the calcaneus to the fibula. Then, as we flip the model to the back here, we have the PTFL, which is short for the posterior talofibular ligament. So posterior meaning that it's towards the back, and once again, talofibular because it is attaching the talus and the fibula together. All three of these ligaments contribute to lateral stability of the ankle, and you can see on the model here that as I put the model through inversion, as I do this, it is trying to separate that lateral compartment here. So those ligaments essentially prevent us from having an ankle dislocation when we go into forced inversion like so. This is an extremely risky position, not just because of the potential damage to the ligaments, but also because anytime we go through any sort of forced inversion, you can see we're getting a lot of compression of the medial malleolus. We're getting a lot of gapping of that lateral malleolus, and this greatly puts somebody at the risk for having a fracture. Fortunately, in Bernard's case, he's already had those x-rays and it's been reported that they are negative, but we have that MRI coming up tomorrow, and this brings me to our grading system. So when it comes to grades of ankle sprains, we have grades 1, 2, and 3. In a grade 1, this is where you're getting stretching of the affected ligament. In a grade 2, you're getting partial tearing. And finally, in a grade 3, this is where you're getting a full rupture. There is an in the clinic or on the field test we can do to determine if we think somebody is dealing with an ankle sprain. This is something known as a Taylor tilt test. So what we're going to do is we're going to take the person's foot and we're going to basically passively take them into inversion. And as we do this, if the person points and confirms that this is painful, then this makes us think that they are dealing with an ankle sprain. We can bias the ligaments a little bit by putting the foot in different sorts of positions. So if we put the person more in a plantar flex position and inversion, this is going to bias a little bit more of that ATFL. If we put them more in a neutral foot position and go into inversion, this is going to bias more of that CFL. And finally, if we dorsiflex a little bit and then go into inversion, this is going to bias a little bit more of that PTFL. But of course, that gold standard that he's going to be having tomorrow, this is going to tell us the severity. It's also going to tell us the specific ligament that's going to be affected in this sort of an injury. So once we hear a little bit more about that information, I'll be sure to update everybody in the comment section. Once we know exactly the severity as well, we can determine an accurate time frame for him to return. If it is more along the lines of a low-grade ankle sprain, this can sideline anyone from a few days up to about 2 weeks. And then of course, if the grading is higher than that, it can take significantly longer. Usually grade 3s, because this is usually accompanied by ankle instability. This is going to unfortunately require some surgical intervention. So once we also have more information about the severity, we can determine an accurate time frame. So we'll await the results of Terrel Bernard's MRI tomorrow. We wish him the best of luck moving forward, and we hope that it's more along the lines of one of those low-grade sprains, because he's having a great year so far, and we really want to see him go further on in the playoffs. Thank you so much for watching my video today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the videos that I've done in the past. Thank you once again for tuning in, and I'll see you next time.